a newly released toolkit from the medical debt advocacy organization, Undue Medical Debt, aims to equip doctors with the resources necessary to navigate the increasingly complex financial landscape of their patients. This initiative arises from a growing recognition among medical professionals that they are inadvertently becoming financial advisors, a role they neither sought nor received training for. The escalating crisis of medical debt in the United States necessitates this intervention, forcing doctors to grapple with issues far removed from their core medical expertise. Despite the widespread prevalence of health insurance coverage, with over 90% of Americans possessing some form of it, a startling statistic reveals that approximately 41% of U.S. adults, representing over 100 million individuals, are burdened with medical debt. This debt manifests in various forms, from outstanding credit card balances and protracted payment plans with healthcare providers, to loans from family members and engagements with debt collection agencies. Surveys consistently highlight the pervasive nature of this problem. The origins of medical debt are multifaceted and deeply intertwined with the intricacies of the American healthcare system. High deductible plans impose significant cost-sharing burdens on patients. Unexpected expenses, such as out-of-network emergency services like ground ambulance transportation, can trigger crippling debt. Insurance denials, a frequent source of frustration, further exacerbate the financial strain. Moreover, the sheer number of medical appointments required for managing chronic conditions like diabetes or cancer adds to the cumulative financial pressure, leaving patients with substantial out-of-pocket costs. Dr. Stahl succinctly summarizes the situation. The business of medicine is overshadowing what they were trained to do, and that really means people are showing up not fully understanding their insurance or very fearful of accruing medical debt. This observation underscores the urgent need for solutions that address both the medical and financial aspects of patient care. The rising awareness of the medical debt crisis has prompted some political action, albeit with mixed results. During the final days of the Biden administration, a significant regulatory change was implemented, prohibiting credit agencies from including medical debt in credit reports. This measure offers some relief to those struggling with medical debt. However, countervailing forces threaten to worsen the situation. The Trump administration's policies, including potential cuts to government-funded health programs, are predicted to expand the reach of medical debt. Further exacerbating the issue, confirmation hearings have revealed support for adding work requirements to Medicaid, a move that could disenfranchise many low-income individuals from crucial healthcare coverage without demonstrably increasing employment rates. These conflicting policy approaches highlight the complex political landscape surrounding healthcare access and affordability, leaving many vulnerable to the debilitating effects of medical debt. The situation remains deeply concerning, demanding comprehensive and sustained efforts to alleviate the burden on millions of Americans struggling to navigate the complexities of both their health and their finances. The toolkit provided by Undue Medical Debt represents a crucial step in empowering doctors to provide more holistic and compassionate care in this challenging environment. It is a vital contribution to a broader conversation that must address systemic issues within the healthcare system to prevent the further escalation of this pervasive problem. The impact of these conflicting policies and the subsequent effects on the already strained healthcare system warrants further analysis and proactive solutions to prevent a further crisis. The sheer scale of medical debt in the United States necessitates a multi-pronged approach involving not only medical professionals and advocacy groups, but also policymakers committed to creating a more equitable and accessible healthcare system for all citizens. This complex interplay of healthcare access, cost-sharing, and debt collection underscores the urgency of systemic reform. The long-term consequences of insufficient action are substantial and will only contribute to the deterioration of public health outcomes and financial stability for millions of Americans.